So here we are going to focus on mental health nursing, especially the anxiety. So what is anxiety disorder, and also what are the nursing intervention? This is the focus right now. So anxiety, here they said anxiety is a normal response to the stress, a subjective experience that include the feelings of apprehension or uneasiness or uncertainties. So mild anxiety is a normal response to the stress. So stress is the part of life. Every person have to know how to deal with the stress. If stress is not under your control, stress will control you. So when we have stress and stress lead to the anxiety, if anxiety is mild, it is productive. Like example, we are preparing for NCLEX board exam. I need the license, so I have to study more. So this mild anxiety push me up for more study. It is productive. But when anxiety is mild or moderate or panic level, it reduces my productivities, my performance, right? So if we really know how to deal with the anxiety, how to control the anxiety or stress, then everything will be smooth. So what next? Anxiety occur as a result of threat that may be misperceived or misperceived, right? So mild anxiety associated with everyday life and can be motivating us, right? Also the behavior like food trapping. What next? The type of anxiety, normal, acute, or chronic. The normal is a short-term, healthy type of anxiety. Acute, the percep- precipitating by innate loss or change that threaten one's sense of security, right? So chronic one, anxiety that persists as a characteristic response to daily activities. So here we go, the anxiety different types. So according to the duration, we categorized acute and chronic, or according to the severity, we categorized mild, moderate, severe, and panic level. Before to go the level of anxiety, here we are going to trace out 4 different type of anxiety disorder, and these are the most common anxiety disorder and be able to manage by yourself. Example, generalized anxiety disorder. So definitely it is associated with everyday life. So if you really know how to motivate yourself, then you kick out the anxiety from your life. Another is obsessive compulsiveness, and also social anxiety or social phobia, and post-traumatic stress disorder. Let me recap these four types. One, we said the post-traumatic stress disorder. So if anybody exposed to the traumatic events like rape or physical abuse or military combat, that can cause the anxiety. Another one is called social anxiety or social phobia, right? It is very common. We do not feel comfortable to talk to the in front of the public, and different people has a different kind of phobia, and they like to withdraw themselves, right? Another one is called obsessive compulsiveness, means patient has persistent thought, right? And patient also engaged in compulsive or obsession behavior, and they do it because of anxiety. Hmm? And another one is a generalized anxiety disorder. And what I said, it is related to our daily associate with our everyday life. What next? Next here, we're going to categorize anxiety level. First one is a mild. So what right here? Associated with the tension of everyday life, the individual is alert, and also perceptual field is increased. Perceptual increase. So what is perceptual field? So perceptual field relating to the ability to interpret or become aware of something through the sense. And this is called perceptual field. In mild case, perceptual field is increased, and mild anxiety can be motivating, produce the growth, and hence the creativities and increase the learning. The easy example, if I really need the NCLEX licensing exam, because I'm investing my time, I am investing my money, it will push you for more study, and you will get your license. So it is productive, produce the growth, increase your creativities, increase the learning abilities. What are the moderate one? Focus is on immediate concern. So immediate concern is important, and narrowing the perceptual field. The mild anxiety narrow the perceptual field. What is perceptual field? Let me recap it. It is relating to the ability to interpret or becoming aware of something through the sense. Also, selective inattentiveness occur, right? Learning and problem solving still occur. So, moderate case, the narrow the perceptual field, learning and problem solving can take place. And difficult to concentrating. What about the moderate and severe, especially the severe right now? So severe anxiety is a feelings that something bad is about to happen. A significant narrowing the perceptual field. Focus is on minute to scattered deals. All behavior is directed at relieving the anxiety. Learning and problem solving are not possible. Individual need the direction of focus. So in severe cases, the main focus, let me recap it, the perception greatly reduced and no ability to problem solving. As like at a severe level, the or panic level, the severe cases, patient feeling of doom, patient feel tachycardia, hyperventilation, or rapid speech, right? And I, I said learning and problem solving cannot take place. And they need direction to focus and difficulty to following the direction or direction. What about the panic level? So here in this level, individual loses the touch with reality and also disturbed behavior. Usually in these cases, you see in this cartoon here, the I think dilated pupil and patient have abnormal belief like delusion, hallucination, or severe withdrawal symptom, right? They're most common. Let me read it. The panic is associated with the terror or sense of impending doom. What does it mean? Impending doom? So impending doom is sensation or impression that something tragic is about to occur. And also personality is disorganized. The individual is unable to communicate or function effectively. So everybody can know how to communicate, but communicate will be productive, communicate will be effective, and you by the communication, the sender can transfer some information to the receiver. If it is not occur, we say it is not effective. Also increase the motor activities, loss of rationalized thinking, inability to concentration, and if it is prolonged, panic can lead to exhaustion. So panic level, the most important sign, the sense of impending doom. Personality is disorganized and cannot communicate or function effectively, and loss of rational thoughts. Patient have abnormal belief we call delusion, and abnormal false belief with perception we call hallucination. Also inability to concentrate, right? So when we work with the patient who have panic level anxiety, what is our intervention, right? So when we intervention with them, first of all, set limit on behavior, also give them simple direction, and also counseling, psychotherapy, and then medication. Let me read it, what wrote here. Recognize the anxiety first, underlying cause, establish trustable relation with the patient, and protect the client, and do not criticize. We always respect our patient, whatever it is. We will respect them, right? And also, we will educate them how to adjust with the problem. It is called coping mechanism. And do not force the client into the situation that provide the anxiety, and modify the environment by setting limit or limiting interaction, and provide creative outlet, provide activity that limit the amount of time for destructive behavior. What are the other intervention? Promote the relax techniques such as breathing exercise, and also help them how to imagination or visualization, monitor their vital sign, give them anti-anxiety medication, and also immediate nursing action for the client with anxiety is to decrease the stimuli in the environment and provide quiet environment. If your patient has a mild to moderate anxiety, what are the nursing intervention? Mild to moderate here. So active listening is very important. So when you listen them, your patient feel good to verbalize their feelings. Also, evaluate your patient past coping mechanism, assist the patient with problem solving, educate how to relax or relaxation technique, mean abdominal breathing exercise or encouraging exercise to reduce the anxiety. Let me read what the point here. Help the client identify the anxiety, encouraging the client to talk about the feelings, help the client identifying the thoughts and feelings that occur before onset of anxiety. As I told you, we could evaluate the patient past coping mechanism. Also, we assist them with the problem solving. Help the client identify thoughts, encouraging problem solve, encouraging gross motor exercise. We called exercise, tell them to do exercise because exercise to reduce the anxiety. What are the intervention if severe or panic level anxiety? If severe or panic level, we provide a quiet environment with minimal stimulation and remain with the patient and set limit with short or simple statement. Help the patient to focus on reality, and problem solving is not a realistic at this level of anxiety, because we are talking about the severe to panic level anxiety. So let me read one more time. Reduce the anxiety quickly, use a clean manner, and always remain with the client, because patients have a delusion, hallucination, even they're harmful to themselves. Minimize environmental stimuli, provide the clear, simple statement. So your patient has psychological problem, you do not need to talk loudly. So use the low pitch volume when you talk. Attend to physical needs to the client, provide gross motor activities, and also admin anti-anxiety medication is prescribed. So that is enough for anxiety disorder and nursing intervention.